back. Well, let's now take a look at the situation in Scotland. And like in England, Scotland too has been placed under lockdown, and Scots have been ordered to stay home amid the fresh COVID lockdown, which will see schools remain closed to pupils until February. The new laws also require people to stay home and work from home as much as possible. Outdoor gatherings have been absolutely cut out, and the situation, though we're seeing, you can see that spike there, the number of cases being reported is increasing. We're joined now by Dr. Aviral Vatsa to talk more about the situation in Scotland. Doctor, if you can tell us, about the number of cases are spiraling, and hopefully this lockdown being declared should bring it under control somewhat.
Indeed, as you said, the situation is quite worrisome because the new strain is spreading quite fast, and so much so that, especially in England, even the lockdown measures which were taken during December time, the restrictions, not the lockdowns, they did not help in curbing down the spread of infection, and that infection has reached also Scotland, and the cases are on the rise. However, it's worse in England than in Scotland, but nevertheless, the worries are also here in Scotland. As you probably already know, the First Minister of Scotland, Nicola Sturgeon, she has announced a total lockdown till middle of February. So that is similar to the situation we had back in March and April. It's actually more worrisome than it was at that time because the standard measures are not helping yet to curb down the infection. And if I could add, if I could add to that, to give you a number, that especially in England, the numbers are that from anywhere between 3 to 6 beds per hospital are already filled up with COVID patients, which is very, very alarming. And it is expected that in the next couple of weeks, at least it will take another 2 to 3 weeks for this to I wouldn't say to flatten the peak, but at least that's where it starts to stabilize. So we are looking down the barrel for another 2 weeks at least.
All right, so that sounds quite worrying, down the barrel. And just tell us, how is the vaccination program there proceeding? We're waiting for it to begin here in India, but we do know there have been complaints about how slow the inoculation has been going and trying to keep up with the spread of the virus.
The vaccination program is definitely, it's surely lagging behind the spread of the new strain or the spread of the virus. And initially, the doses we got for the Pfizer vaccine, they have all been kind of used up. The first doses were used up, and we're waiting on the Oxford vaccine, which has been rolled out from Monday. We are expecting that it'll speed up because the logistics are much simpler, and the doses are coming through. And the second decision the other decision by the UK government, including the Scottish government, that we will only give the first dose to start with of the Pfizer vaccine, and the second dose has been delayed. And that second dose, which is reserved for the people, that is to be given to other people as first dose. Now, that is a step to increase the coverage of vaccine in the public. There is very little scientific evidence, tested scientific evidence behind that the immunity shall last beyond few weeks' time, but it is just it is the likelihood that the immunity will likely last beyond that, and then if we have more number of people who are relatively safer against the virus, then probably we are better off. So that's the thinking behind it. As I said, there is no hardcore scientific evidence behind it because the vaccine companies have not tested immunity after the first dose beyond a few weeks' time. So the vaccine is expected to pick up. It is slowly picking up, but we are definitely lagging behind. And as you are mentioning, the fatigue is setting in across the healthcare systems.
All right. Well, thank you so much, Dr. Vatsa, for speaking to us here at NDTV, and all the best ahead.